Hello everyone, I hope you are all having a good day. For today, we the Group 3 will be discussing about assessment of high-risk pregnancy. On this, our group will discuss the definition of high-risk pregnancy, the causes, the factors, and more. So before I start the discussion, I would like to also get this chance to introduce my other group members that you will meet later on. First, we have Aquino Ella Charis, Espada Lenny Ann, Lipawan Aisel Audrey, Maghirang Carl Johan, yours truly Ordoño Freya Ann, and Tadina Tracy Adeline. So now let's start the discussion. Let us first identify what is high-risk pregnancy. So high-risk pregnancy is known as one in which a concurrent disorder, pregnancy-related complication, or external factor jeopardizes the health of the woman, the fetus, or both. Some women enter pregnancy with a chronic illness that when superimposed on the pregnancy makes it high risk. Other women enter pregnancy in good health but then develop a complication of pregnancy that causes it to become high risk. Furthermore, when a woman enters pregnancy with a chronic condition such as cardiovascular or kidney disease, both she and the fetus can be at risk for complications because either the pregnancy can complicate the disease or the disease can complicate the pregnancy, affecting the baby or leaving a woman less equipped to function in the future or undergo a future pregnancy. Now that we have identified what is a high-risk pregnancy, let us now know what are the different causes that may contribute to high-risk pregnancy. First, it occurs because the woman has a medical condition. It's possible that the woman was already dealing with the health issue before becoming pregnant, such as diabetes or cardiovascular disease, or that it manifested itself as a result of her pregnancy, like iron deficiency anemia, which develops when the red blood cell count, also known as hemoglobin or hematocrit, is low. Second, it may result from environmental hazard. The mother and child may experience negative health effects from exposure to environmental hazards like tobacco smoke, pesticides, solvents, lead, mercury, and other chemicals. Exposure to this risk can have a harmful effects on a fetus' health, including miscarriage, stillbirth, delayed fetal growth, birth defects, and increased risk of certain illnesses. It can also be because of history of pregnancy complication. This one applies to multigravid women who have difficulties with their first pregnancy. We also have the circumstances that causes women to be high risk. The first one is poverty. One of the most frequent causes of pregnant women being at high risk is poverty, especially if the woman is unable to meet all of her needs, particularly her nutritional needs, because it may be expensive for them. Another is lack of support people. A pregnant woman needs every support she can get, especially from her parents and the baby's father. Without a family to support her and reassure her of things, it could be too much for her to handle, especially when her hormones start to affect her emotionally. And in relation to that, poor coping mechanism may also be a cause. If a woman is unable to manage her pregnancy on her own, it can result in anxiety and depression, which could be dangerous for both the mother and the unborn child. Lastly, we have the genetic inheritance. It's possible that the father or the pregnant mother inherited a disease that put the pregnancy or the unborn child at risk.
Demographic factors. Maternal age. Women under the age of 20 have a higher risk of serious medical complications related to pregnancy than those who are over 20. Teenage mothers are more likely to develop preeclampsia, deliver prematurely, have a baby with low birth weight, and can experience pregnancy-induced hypertension. Some risk factors connected to young age include the following. Underdeveloped pelvis. Young women's bodies are still growing and changing. An underdeveloped pelvis can lead to difficulties during childbirth. Next is nutritional deficiencies. Young women are more likely to have a poor eating habits. Nutritional deficiency can lead to extra strain on the body that causes more complications for both the mother and the child. Next is high blood pressure. Developing high blood pressure in pregnancy can trigger premature labor. This can lead to premature or underweight babies who require specialized care to survive. Women over age 35. As you age, your chances of conceiving begin to decline. An older woman who becomes pregnant is also less likely to have a problem-free pregnancy. Common issues include the following. Number 1 is underlying conditions. Older women are more likely to have conditions like high blood pressure, diabetes, or cardiovascular disease that can complicate pregnancy. So when these conditions aren't well controlled, they can contribute to miscarriage, poor fetal growth, and birth defects. Number 2 is chromosomal conditions. A woman over 35 has a higher risk of having a child with birth defects due to chromosomal issues. So, Down syndrome is the most common birth defect related to chromosomes. It causes varying degrees of intellectual disability and physical abnormalities. Prenatal screening and tests can help determine the likelihood of chromosomal complications. Number 3 or other complications. Women over 35 are more likely to have complications commonly associated with pregnancy regardless of age. It includes an increased risk of developing high blood pressure or gestational diabetes while pregnant, being more likely to have a multiple pregnancy, twins or triplets, or higher likelihood of low birth weight, and needing a cesarean delivery. Poverty. The early child health consequences of poverty and pregnancy are multiple and often set a newborn child on a lifelong course of disparities in health outcomes. Included are greatly increased risks for preterm birth, intrauterine growth restriction, and neonatal or infant death. Poverty has consistently been found to be a powerful determinant of delayed cognitive development and poor school performance. Behavior problems among young children and adolescents are associated strongly with maternal poverty. Maternal parity or multiparity. So if you had 5 or more previous pregnancies, you are more susceptible to abnormally quick labor and accompanying excessive blood loss during future labors. Complications arise in multiple birth pregnancies because more than one baby is growing in the womb. Because of the limited amount of space and the additional strain multiple fetuses put on a woman, these babies are more likely to arrive prematurely. Many pregnancy complications like high blood pressure and diabetes are more common in multiple pregnancies. Hemorrhage, CS or cesarean, fetal loss, and abortion are the other complications. Personal and social factors. Weight. Women who are very thin with a BMI of less than 19.8 or weigh less than 100 pounds before becoming pregnant are more likely to have small and underweight babies. Overweight women with a BMI of 25 to 29.9 before pregnancy and obese women with a BMI of more than 30 are more likely to have the following problems. Very large babies or large for gestational age, which may be difficult to deliver. Babies who are born underweight or small for gestational age. Babies with birth defects, miscarriage and stillbirth, gestational diabetes, gestational hypertension or high blood pressure that first develops after 20 weeks of pregnancy. Preeclampsia or gestational hypertension accompanied by protein in the urine. A pregnancy that lasts 42 weeks or longer or post-term pregnancy. And lastly, a need for a cesarean delivery. Height. Women shorter than 5 feet are more likely to have a small pelvis, which may make movement of the fetus through the pelvis and vagina or birth canal difficult during labor. Next is smoking. If you smoke while pregnant, you are at increased risk of a wide range of problems including miscarriage and premature labor. You are twice as likely to give birth to a low birth weight baby compared to a mother who doesn't smoke. Lifestyle and occupation factors. Alcohol or illegal drug use. Alcohol during pregnancy increases the risk of miscarriage, stillbirth, and newborn death. Any alcohol use, especially heavy use, can increase the chances of your child having lifelong physical, behavioral, and intellectual disabilities. A mother taking illegal drugs during pregnancy can increase her risk for anemia, blood and heart infections, skin infections, hepatitis, and other infectious diseases.
Obstetric factors and gynecologic history. Birth of previous infant with weight of 8.5 pounds. Most large babies who weigh more than 4.5 kilograms do not have a difficult birth, but there are still some risks associated with having a big baby. Labor may take longer and be more likely to involve complications. There's an increased risk of having a forceps or vacuum-assisted delivery or a cesarean, and of birth injury to the mother or baby. A larger than average baby may need help breathing following the birth, so they may be admitted to the neonatal intensive care unit or special care nursery. There's also an increase of jaundice among large babies. Previous stillbirth. On average, women who have one stillbirth are 2 to 10 times more likely to have another stillbirth than are women who have not had a stillbirth. Nonetheless, most women who got pregnant after a stillbirth deliver a live and healthy baby. Increased risk depends on several factors like race, cause of the prior stillbirth, the timing of the prior stillbirth also has an effect, and fetal growth restriction. So what is Rh sensitization during pregnancy? You may have Rh negative blood and your baby may have Rh positive blood. If the two types of blood mix, your body will make antibodies. This is called RH sensitization. In most cases, this isn't a problem for the first time you're pregnant. But in future pregnancies, sensitization could cause problems. So during your first pregnancy, the baby probably would not be affected. But if you get pregnant again, the antibodies could attack baby's red blood cells. This can cause the baby to have anemia or jaundice. Cervical insufficiency or cervical incompetency. Risk factors for cervical insufficiency include cervical trauma. Some surgical procedures used to treat cervical abnormalities associated with an abnormal pap smear can result in cervical insufficiency. Other surgical procedures such as a DNC could also be associated with cervical insufficiency. Rarely, a cervical tear during a previous labor and delivery could be associated with an incompetent cervix. Complications. An incompetent cervix poses risk for your pregnancy, particularly during the second trimester, including premature birth and pregnancy loss. Multiple gestations. Multiple birth babies have about twice the risk of congenital present at birth abnormalities, including neural tube defects, gastrointestinal, and heart abnormalities.
Factors that categorize client to be high risk under the pre-pregnancy. For the psychological, history of drug dependence including alcohol, history of intimate partner abuse, history of mental illness, history of poor coping mechanism, cognitively challenged, and lastly is the survivor of childhood sexual abuse. For the social, we have the occupation involving handling of toxic substance including radiation and anesthesia gases, environmental contaminants at home, isolated, lower economic level, poor access to transportation for care, high attitude, highly mobile lifestyle, poor housing, lack of support. And for the physical, we have the visual or hearing challenges, pelvic inadequacy or misshape, uterine incompetency or the position or the structure, secondary major illness like heart disease, diabetes mellitus, kidney disease, hypertension, chronic infections such as tuberculosis, hematopoietic or blood disorder, and malignancy. History of previous poor pregnancy outcome like miscarriage, stillbirth, intrauterine fetal death, history of child with congenital abnormalities, obesity under the BMI of higher than 30, and underweight. So for the pregnancy, under the psychological, we have the loss of support, illness of a family member, decrease in a self-esteem, drug abuse including alcohol and cigarette smoking, poor acceptance of pregnancy. And for the social, we have the refusal of neglected prenatal care, exposure to environmental teratogens, disruptive family incident, decrease of economic support, conception less than 1 year after the last pregnancy. And lastly, we have the physical. Under it is the subject to trauma, fluid or electrolyte imbalance, intake of teratogen as drug, multiple gestation, a bleeding disruption, poor placental formation or position, gestational diabetes, nutritional deficiency of iron, folic acid or protein, poor weight gain, so in the pregnancy, the induce of the hypertension, also for the infection, amniotic fluid abnormality, and lastly is the post-maturity.
Factors that categorizes client to be high risk during labor and delivery. In psychological are the severely frightened by labor and birth experience, inability to participate because of anesthesia, separation of infant at birth, lack of separation for labor, birth of infant who is disappointing in some way such as sex, appearance or congenital anomalies, and illness in newborn. In social are the lack of support person, inadequate home for infant care, unplanned cesarean birth, lack of access to continued health care, and lack of access to emergency personnel or equipment. In physical are the hemorrhage, infection, fluid and electrolyte imbalance. Vulnerable groups of pregnant women. Adolescent and 18 years old and below are at increased risk of having preeclampsia, preterm labor, and anemia. Mentally ill. If the illness is not treated, this may be more harmful for the baby than the effect of medication. Untreated mental illness can cause a number of problems, like babies having low birth weight. Untreated mental illness can also affect a baby's development later on. Physically and cognitively challenged often struggle following instructions or recognizing the conditions that require medical help.
Next one are the diagnostic tests, laboratory exams, and screening procedures that are usually done during pregnancy. Diagnostic tests, lab exams, and screening procedures are important for the mother and her unborn child. These tests can detect birth defects, anomalies, and the fetal well-being. The first one is the ultrasonography. Ultrasonography, or most commonly known ultrasounds, are performed to evaluate the development of the fetus, and within 18 to 20 weeks, it can detect gross anomalies. Second is the bioprofile. A bioprofile or biophysical profile is a test that is something used during the third trimester of pregnancy. It is often done if there is a question about the baby's health. This may be because of a mother test results or certain pregnancy symptoms, or because your pregnancy is high risk. During the biophysical profile, your provider is looking at 5 main areas to check your baby's health: the body movements, muscle tone, breathing movements, amniotic fluid, and heartbeat. Third test is the amniocentesis. Amniocentesis is a test you may be offered during pregnancy to check if your baby has a genetic or chromosomal conditions such as Down syndrome, Edwards syndrome, or Patau syndrome. It involves removing and testing a small sample of cells from the amniotic fluid, then the fluid that surrounds the baby in the womb or the uterus. It is usually done between 14 to 16 weeks of pregnancy. Fourth one is the NST. A non-stress test is a common prenatal test used to check up on a baby's health. During a non-stress test, the baby's heart rate is monitored to see how it responds to the body's movements. Typically, a non-stress test is recommended when it's believed that the baby is at increased risk of death. A non-stress test may be done after 26 to 28 weeks of pregnancy. The fifth one is the AFI, or the amniotic fluid index. The amniotic fluid index is a standardized way to assess the sufficiency of amniotic fluid quantity in pregnancy. The amniotic fluid index is used in patients who are at least 24 weeks pregnant with a singleton gestation. 6 is the kick count assessment tool. You can ask the mother to perform Sandowski or Cardiff method that are usually done after meal, and normal finding should be 10 movements per hour. 7 is AFP, or the amniotic fetoprotein. An AFP blood test is used during pregnancy to check the baby's risk of birth defects and genetic disorders such as neural tube defects or Down syndromes. AFP is usually done at 15 to 20 weeks of pregnancy. 8 is the diabetic screening. The screening test is called an oral glucose tolerance test, OGTT, which takes about 2 hours. It involves having a blood test in the morning when you have not had any food or drink for 8 to 10 hours. You're then given a glucose drink. After resting for 2 hours, another blood sample is taken to see how your body is dealing with the glucose. The OGTT is done when you're between 24 and 28 weeks pregnant. Percutaneous blood sampling, or the chordocentesis. It is a quick test, fetal blood sampling or umbilical vein sampling. The doctor takes fetal blood directly from the umbilical cord and uses it to check for disorders in the fetus. 10th is the sickle cell test. This is done to detect presence of sickle hemoglobin in at-risk women. 11th is the group B beta streptococcus. GBS can be found by testing urine or swabbing the cervix, vagina, or rectum. The 12 are the basic lab tests. First lab test is the blood screening for Rh factor. This is a procedure that determines whether the blood cells have the Rh protein on the structures of the blood cell. Second is the VDLR. This test is used to screen for syphilis. Syphilis screening is a routine part of the prenatal care during pregnancy, and it is usually done at 32 weeks. Next is the urine testing, or our urinalysis. A urine test is used to assess bladder or kidney infections, diabetes, dehydration, and preeclampsia by screening for high levels of sugars, proteins, ketones, and bacteria in the urine. Next is the pap smear for STD. And lastly is the stool culture for ova and parasites. This is to prevent the spread of these microorganisms to the newborn and avoid outbreaks of this infection in the nurseries.
Danger signs of pregnancy. Normal pregnancy can be a crisis because it is a time of significant change and growth. A woman with a complicated pregnancy has stressors beyond those of the normal pregnancy, and so the woman should be instructed to return to the healthcare provider if she notices any of the danger signs like pain, persistent vomiting, headache, vaginal bleeding, blurred vision, dizziness, sudden gush of fluid from the vagina, chills and fever over 38 degrees Celsius, and painful urination or reduced urine output.